Your periods change as you age between 17, 27, 37, 47, and beyond. But what is normal and what is abnormal, and when should you come in and see a gynecologist? Hi, I'm your local OBGYN. I love women. And if you want more women's health, follow along here. When you're a teenager, your ovaries and your estrogen is at like a very quiet state. And when you hit puberty, it starts to creep up, and suddenly you may see your first period, but those ovaries are not mature yet. So regular cycles are not guaranteed. Some girls will get that, some will not. If you have extreme heavy bleeding, skipped cycles for like more than 6 months at a time, you're not seeing other signs of puberty or severe pain, go see an OBGYN. In our 20s is when most women's ovaries are kind of hitting their mature stride. So you're going to start to expect that they hit more regularity in your bleeds and more predictability. The average cycle length is technically normal if it's 21 to 35 days. Most women will hit that 28-week-ish cycle. It doesn't have to be perfection, but that's considered normal. If you start to see extreme variation in the timeline or significantly heavy bleeding, painful bleeding, stuff that's making you miss life, like school or work or things that are going on, or if you're bleeding through things, these are the times to go in. You may need to be evaluated for bleeding disorders or other hormonal disruption. In our 30s is when life starts to kind of like creep in and affect what our cycles are doing. It could be that you had a baby or you're breastfeeding. Stress can play into this, and lifestyle starts to wear and tear in our system at this point. So other medical conditions can mess with our cycles. So you may start to see some skips or even some early signs of menopause, even if you have a regular cycle. So you start to see the periods kind of like creep a little closer together from first day to first day, or the length start to get longer, or the amount start to get heavier. And these could be signs of other things like fibroids, hormones, other things. And in our 40s, that's when our ovaries are starting to turn off. But again, it is not a regular smooth process. It can feel like a full-blown roller coaster where one day everything feels good, the next day not, and the next day back again. You will start to see shorter cycles, maybe heavier flows, maybe lighter flows, maybe long flows. All of this can be within the realm of normal. The problem becomes, again, if there's significant pain, if you're bleeding for a length of time really longer than like 7 to 8 days, or if you're experiencing some other symptoms that are bothersome associated with perimenopause and menopause, like hot flashes, night sweats, all the stuff that we're educating on here. That's again when you may want to go in and either seek help or an evaluation for something else that's going on. And then when those periods go away, if you have not had a period for 12 months, guess what? Go in and see the GYN. Chances are it's nothing, but there's still a significant risk that there could be something growing abnormally in your lining, and you need an evaluation to make sure it's nothing bad.